you're one of our fellows that didn't do their internal medicine training here. What attracted you to the program?
Yeah, a few things. Probably the biggest thing was that I had some colleagues who had trained where I did internal medicine. So I was at Brigham and Women's Hospital, and we have several people who've come from Brigham and Women's to come out here to Stanford to train in cardiology after doing their internal medicine at Brigham. And I'd spoken to a few of them when I was looking at programs, and I just kept hearing rave reviews from those fellows who come out here. And so that really helped to sell me on the program. I think our program at Brigham for internal medicine was very collegial. And one of the things I kept hearing from people who would come out here was just how the same culture of collegiality amongst the fellows and amongst the attendings was out here as well. So that definitely drew me in. I think the other thing was that in my area of research, so I'm interested in health services research, there were several mentors out here who had a track record of training cardiology fellows, and those fellows had gone on to be very successful. So that was a big part of it. And then the other thing was I'm interested in general cardiology clinically. And I think the program out here, one of the things I kept hearing was that you really got a lot of exposure to all different aspects of cardiology, and especially in terms of getting echo numbers, and the clinical volume was totally enough to get a very good general cardiology training, so much so that you could comfortably, if you ended up doing academics, could be in general cardiology practice in academics. And if you ended up going into private practice, you were fully trained to be a general cardiologist in private practice. So I think all those things were really what drew me to the program out here.
What has been your experience in terms of your clinical training so far?
Yeah, so the clinical training has really been excellent. I think one of the things that I didn't necessarily appreciate as an applicant is that all the services here at Stanford are run by the general cardiology fellows. And that includes the consult services, obviously, but also the echo lab is run by the cardiology fellows, the general cardiology fellows. We field all the TEE requests for the whole hospital for diagnostic TEE. Same thing goes for the cath lab. Anytime a request comes into the cath lab, it actually comes through the general fellows. So you really get a lot of ownership of all the clinical services, and feel like you have the opportunity to really learn each area of cardiology, how the decision-making works, and who should go for a procedure and who shouldn't. And so I think that part of the training has been really rigorous. Also in terms of, one of the things that drew me here was the clinical volume, and I think that's definitely borne out to be true. I've had the opportunity to get all the numbers within, even first year, I had all the numbers that I needed to get level 2 for echo for transthoracic. As a second year, I've done over 100 TEEs. And so you really do get a breadth of clinical experience here. And then the consult service has really been, it feels like a great learning experience, because we get there's a huge oncology service here. We see a lot of cardio oncology on the consult service. So it's really been a very rigorous training, but also not so much so that I feel burnt out or feel like was overworked in any capacity. It's very educationally oriented.
Thank you. Yeah. And maybe touch on the CCU experience a little bit, the critical care cardiology experience.
Yeah. So I think the CCU is, it's a fellow-led service similar to our other services. You really have ownership for all the patients in the CCU. And I think one thing that is a nice feature of our program is that when you're on, you're sort of the fellow for those patients 24/7. And it really isn't too hard from a work-life balance standpoint, but it really makes you feel like you have ownership for the patients, because you really get to be aware of all the moves that are going on with them overnight during the daytime. So you really feel like you have a great sense of what's happening with the patients and can take full ownership. And then the attendings who work in the CCU are some of our top attendings in terms of teaching. And so it's really a wonderful experience in terms of learning from these master clinicians. And they really do kind of take you under their wing as their fellow when you're on the CCU. One of the attendings, Dr. Ashley, you and Ashley, will even every morning when the medicine residents go for their teaching conference, he'll take you for coffee and you sit down and do a little chat, and he talks to you about your research, his career, your career, what your interests are, the CCU. And so you really do get a great mentorship experience with the CCU attendings as well as the clinical experience.
Yeah. You are lucky enough to be here during a time when we've opened up a brand new hospital. Can you talk a little bit about how the opening of what we call 500P has changed the fellowship experience?
In the most obvious sense, it's added a lot more beds to the hospital. So I think that that's pushed the clinical volume in a good way. And only further draws in patients from probably a broader area in terms of having these facilities that are really just cutting edge, top notch. I think it's also, from a fellowship perspective, provided more space for the echo lab, more space for the cath lab. So, we anticipate that procedural volume will continue to grow over time. And then I think as far as a place to work, it's really a very beautiful hospital. And so I think one nice thing is just getting to practice in a place that's so new and has beautiful views of the Stanford campus. And it really makes it an enjoyable experience to be rounding on patients when you're getting to take in the views as well. So it's been a nice addition to the program.
And one of the roles that the chief fellows play is organization of conferences and do a lot of teaching. Tell us a little bit about the role of the fellows in leading the program themselves and teaching and how that has worked out for you.
Yeah, so the role of chief fellow is a tremendous opportunity. You really get to sort of be the conduit between all the fellows, the general fellows, and the program leadership and the division leadership. And a huge part of that is organizing the educational programming, both for the general fellows and for the division, since the chief fellows play a big role in organizing the grand rounds programming for the division. And one of the things we're working on this year, which I think is going to be a tremendous opportunity, is to have the general fellows who are in their third and second years help to recruit grand round speakers. And I think that'll be a huge opportunity for fellows who have specific interest areas for their career or for their research to reach out to speakers from around the country and invite them, and then get some FaceTime with them, and also be able to talk and network with them and potentially other faculty at our division who are doing similar research or in the same area. So I think that's a huge part of what we're doing. And then one of the other aspects of education for our program that we organize is the journal clubs. And that's totally fellow led. So each fellow throughout the year will plan a journal club where they pick an article, they have an assigned faculty mentor, they work closely with that faculty mentor in preparing a handout on the article. And then historically, we've had those journal clubs at faculty members' homes, although that's been a little bit on hold with COVID right now, but we anticipate hopefully that'll come back afterwards. But that's been a huge part where it really brings that collegiality. You're in a faculty member's home, getting to be with your colleagues and sharing that personal interaction as well.
COVID has created unprecedented strains on the healthcare system and fellowships, and we've seen this around the country. I've been amazed at how well the cardiology fellows have responded to this and have really pitched in. Tell us about your experience with COVID and how you feel supported during this difficult time.
Yeah, so I think it's obviously been a huge challenge, I think, for programs around the country. At Stanford, I think one of the things that we immediately started doing, which I think speaks to the role of the chief fellows, is as incoming chief fellow, I helped with this, but also in collaboration with the current chief fellows last year, creating a contingency plan so that if any of the fellows did become diagnosed with COVID or for some reason were unable to come into work due to family issues as a result of COVID, we had an entire plan in place of how we would cover all the rotations and potentially even make additional fellows available to cover other services in the hospital. And I think the speed with which we came up with that plan and how quickly we reacted when we saw what was happening around the country just speaks to the administrative support that we have to run the fellowship program and how involved fellows are in creating those contingency plans. It was really a fellow-led effort to kind of make those plans of what we would do. Fortunately, for our region, we haven't had to invoke any of those plans yet, but I think just being able to have those in place so we had a backup system was a good thing. And then I think the messaging from the fellowship leadership was very, very clear about who would be in charge of doing different procedures and when that should happen. And having the most experienced operators as far as the advanced fellows on the procedures if they were involving COVID patients. And in general, the fellowship has been very clear about clarifying the protocols for getting tested. And if any fellow feels they may have been exposed, they've been fully supported in terms of getting that testing and the protocols that they need to follow, et cetera.
Yeah. Maybe talk to us a little bit about how the VA proximity and the research allows you to get things done that you want to do, and also maybe about your own research.
Yeah. So the VA is a tremendous resource, I think, both in terms of the patient population that it exposes us to as fellows, and we get to work with. The veterans are an amazing population to work with. And I think for research opportunities, it also is a tremendous opportunity to have a VA. The VA in general as a nationalized healthcare system is really a unique opportunity to do policy research. And so my research interests are in health services research. And Dr. Heinenreich does research in health services research and outcomes research. And so the VA with a national data set of hospitals is really the perfect venue to do that kind of research. And so Dr. Heinenreich has been a tremendous mentor for prior fellows, many fellows who've then gone on to faculty positions, who've done health services research here at Stanford and elsewhere. And what's really amazing about him is that he's so hands-on and makes the time to really mentor you, in spite of how many obligations he has and how busy he is because of his success. Just this year, as you mentioned, he got promoted to be chief of the medical service at the VA, which is a tremendous role. But at the same time, while he's in these roles, he also made time while I was doing my grant applications to meet with me, sometimes even for over an hour, going through some of the aspects of the grant application. And as we were crafting the project, getting on phone calls with me, with different folks in VA leadership, and really just was obviously committed to mentoring me and putting in the time that's needed to be a good mentor. And so that's really been a really nice surprise to see how engaged he is. And so I'm looking forward to working this year with him on a project looking at the impact of physician productivity metrics in the VA, and how those influence the way that care is delivered, the quality of care, access to care, and several other aspects of that program. And so I'll be primarily doing my research at the VA, working with him and several other mentors at Stanford and at the VA as well.
After George Floyd's murder, it's been clear that things need to change in the U.S., not only in terms of healthcare, but also cardiology training. And our fellows have been really pitching in to push that message forward. Talk to us a little bit about what you've done and the fellows have done to make progress.
Yes, obviously, in the middle of the pandemic, this is another issue that came up that's so important and so pressing. And I think initially, we were so taken aback that it really was a challenging time, I think, for a lot of people in our division. And so one thing we were doing initially was just trying to support our colleagues, who were affected by this event, and then trying to figure out how we could change as a division to try to address some of these issues that really came to the fore. One of the things we did was early in the year, we had a grand rounds that was specifically focused on a big discussion about these issues and very specifically how they affect Stanford and how we can address some of these issues. And I think that was great that we had that grand rounds, but we really are trying to treat that as a starting point rather than the end of the conversation. And so we've continued to have conversations with division leadership, including Dr. Lewis, and the grand rounds leadership to try to figure out how can we push this forward into the new year. And so there's a couple of fronts on which we're trying to make progress. One is to continue to have a grand round series, recurring series, where we focus on structural inequality and structural racism at Stanford and how we can, within our division make changes, and then more broadly across cardiology. And then I think the other thing we're doing is, as a fellowship program, we're hoping to incorporate into our teaching specific sessions focused on implicit biases, structural inequality, both in terms of gender inequality and racism, and to try to incorporate that as a part of our fellowship education. And we're also, every year we do a quality improvement project. And so this year we've decided that we're going to focus that project on structural inequality, structural racism, and to try to find a way to address that at Stanford and more broadly. And so I think we're really trying to take it seriously and to not see this as a one-off kind of event, but something that we can change the way that we actually operate as a division as a result.
You moved here from the East Coast all the way west. Why should people come west? What's it like being in the Bay Area, et cetera, et cetera?
Yeah, I mean, I'll say, I did not come out here specifically because of the geography of the Bay Area, but it's definitely been a huge benefit in terms of quality of life. I mean, one of the things that my wife and I have been doing during the pandemic is going on hikes, and it's just the opportunity to get outdoors and spend time outdoors here is just tremendous. Just this weekend, we were up in Sonoma doing some hiking and did a wine tasting outdoors, of course. Other weekends, we've been able to go hiking in South Bay, and we've gone to Tahoe to go hiking in Tahoe. And so it's just, especially now that we're sort of more restricted to doing things outdoors, it's really a great place to live because there's just so much to do out here, and there's such natural beauty in the Bay Area that it's really great. So yeah, definitely a good reason to come here.
Thank you. Thanks a lot, Neil.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.